2023 Board of Health meeting. And since I don't have my normal stuff with me, I know the disclaimer is that we're going to talk about everything on the agenda and maybe a few things that aren't on the agenda as permitted by law. And Mark, you can still chime in if you need to. So we'll call the meeting to order at 6:03. Mark, just wish everybody a Happy New Year and a Merry Christmas, because if you don't say something for citizens' participation, I feel like something's missing from the meeting.
Okay. Mark Sony, 49 Hawthorne Road, Ashland, Mass. 01721, ho, 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 we're the Santa's good list now. Yep. Roger said it, and my dad did pass away at December 3rd. And
sorry to hear that.
Yeah.
Yeah.
It was 9 years to take care of him and all that. But now he's he's up there with my mom. They were separated by issues for 24 years now. They're together again. And they're going to have a good holiday, good Christmas, New Year's, all together. And God and Jesus' birthday is going to be well attended by everybody that's involved. So happy holidays.
Yeah. Okay. All right. Thanks, Mark.
Sorry to hear that, Mark. I met your dad a few times.
Yeah.
Over at John's house. He's a good guy. That was a while ago, but I'm sorry to hear that.
Yeah.
Sorry for your loss, Mark.
Yeah.
Yeah, you have our sympathies.
Yeah. Okay. So Laura or Raj, just as a as a matter of kind of how we do this, do we have to read each specific establishment if we go through, let's say, the retail food permits, or can we pass all of these, the retail food permits, the establishment permits? Can we do everything as a single unit, or we need to do them each individually?
Dr. Ron, I guess we can do it all together, so.
Okay. All right, that's great. Anybody want to make that motion and just read through all of the...
Okay, Ron, in the motion, you can
Yep.
say it as listed on the agenda.
Okay. That's great. Anybody want to make that motion? There's
Yeah, so are you saying
to read?
Excuse me, Ron? Sorry.
Yeah, there's a lot. Well, if we do it all at once, then there's...
Yeah.
Okay, go for it.
I can do that. All right.
Okay.
Without even breaking them up into different types of permits, which I'm happy to.
We'll just list them all.
Okay.
Right? So retail, then food establishment, and right.
Yeah. So I will. I'll make the motion to approve the 2024 Board of Health permits pending receipt of all required documentation. Well, or am I?
Do we need to read the individual ones? Retail food permit, then
okay.
Establishment permits. Just I don't know if we do or not, but
I'll do that. I'll do that.
Okay.
So okay, I make the motion to approve the retail food permits, food establishment permits, mobile food, residential kitchens, tobacco permit holders, Ashland animal permit holders, hauler permits, and installer permits.
that's awesome. Anybody want to second that, Dave?
Yes, I second that.
Okay, awesome. All in favor?
Aye.
Aye.
Okay. All right, great.
And there's another section to this, Ron.
Yeah.
The grease
Section
trap waivers.
Yep, go for it.
So, I'll make the motion to approve the 2024 grease trap waivers.
Okay. Any seconds?
Second.
All right, terrific.
Aye.
All in favor? Aye.
Aye.
All right.
Aye.
That's awesome. That was the best. I don't think we ever did that more quickly. All right, moving on to agenda item 5. Jay, you're up.
Okay, well, so we, as I mentioned in the last meeting, we are on for 2024 with the Ram Clinic at Keefe Tech once again on the, I think it is the 10th and 11th of August. And so we're moving ahead. I had a conversation with Ram. We have a new volunteer coordinator that's going to work with us this year. And we have the same clinic coordinator, Kim Falconberry, and we're going to plan a meeting with them in January, a kind of a kickoff meeting. And prior to that, our community host group, which is sort of the inner circle of the chairs. And this year, Dave will be working with us. We will meet on the 9th just to, talk about timelines and get a sense of when we want to do certain things like start fundraising and things like that. This year, it just will be a lot easier. We know what we're doing. So that's really the update. That is, we've started planning some meetings.
Yeah.
And I'm
That's
happy to
awesome.
take any questions that anybody might have about that.
Yeah. I was just going to ask you, it must be so much easier than last year, but so what's the general, kind of like itinerary of the meetings? What do you kind of cover first? What's the first thing you do?
So we have a number. So we've got hospitality, recruitment, promotions. Those are the three, and fundraising. So those are the four main areas that we cover. So everybody we've got somebody that owns each one of those.
Okay.
And for the community host group, each one of us that owns that checks in. So last year we met quite a bit because we were still trying to get a handle on what we were doing and the timing of everything. When is the right time to start promoting the event? When is the right time to start really drilling down into the budget and things like that? But now, we already have a sense of when all that will be. I mean, to be honest with you, if we even started fundraising in maybe March, I think we'd be fine and promoting, at that time. So we don't really need to, I don't think we have to start meeting on a, we were meeting once a month and then another once a month with RAM. I think that's even a lot right now, but just to, I think, get everybody on the same page, it makes sense. So, but that's it. I mean, that's an agenda. And then it kind of takes usually about an hour, and we maintain minutes, and RAM reads our minutes, and they go through our meetings and they make sure that we're on track. And there's some trainings here and there that we need to do, but that's it. I mean, it really is going to be much less effort this time, planning wise. And I will keep you posted, Ron, because I know that you want to be involved on the provider side again. I'm assuming that's what we talked about before.
I'd love to do that, of course.
Yeah. So, and Dave, by the way, so as I mentioned, I did talk to the new volunteer coordinator. This person's name is Zoe. She seems very enthusiastic and has a plan about how she wants to recruit the professionals. I told her about you and that you'd be helping Ed do this. So the community host group, which would be us, will meet on the 9th, and then we'll schedule a meeting with them, and then you'll meet Zoe, and she really seems like she's going to be dedicated to our clinic. So I think it'll be good.
Yeah. Well, I'm sure.
Excellent. Looking forward to it.
Yeah.
Yep.
So just one last thing. How does the fundraising work? Where does that money go, and how much do you need?
So we're looking to get $30,000. And it might end up being a little bit less than that if we have enough in-kind donations. Like last year, for example, we got a number of different things that decreased the hospitality budget. We got that from Metro West Medical Center and some other places, but we start with $30K, and that $30,000 covers food, any kind of permitting, the costs of the venue, putting RAM up at Framingham State, which is where we're going to do it again, their food, any other expenses related to running the clinic labs, things like that. So it usually comes out to about $30,000. Where do we get it? We got it mostly from banks last year, and then individual donors that made up the rest that came in kind of I would say by June we had all of our money, end of June. So we're going to go after those same groups, and but this time we'll have numbers. We'll have the number of people that we served last year, which is 316 patients. We'll have the breakdown in terms of all what services each got. So I think the sell will be much stronger this time. Not that it wasn't before, but I think that they'll appreciate seeing, what their money will do.
Yeah.
So, which is a lot.
Yeah. Wow, that's
Yep.
great. What an undertaking. So, and the experience you gained last year, I'm sure it is a lot easier, but it's still a lot of work. So thank you for, all the effort of putting this together in back-to-back years. That's not an easy task.
Well,
It's still time consuming.
It'll be fun. And Raj has been a big help, and we'll start including you once we get our bearings and figure out, when the board has to come in. And same with you, Laura. I just think this year, again, it's going to be, we know what we're doing, so we really don't need to to really bother you guys yet with anything from a town perspective. So
Absolutely. Sorry.
It's never.
Yeah. Okay.
Okay.
All right.
All right. Great. And then speaking of Raj, agenda item 6, the health director's agenda.
Thank you, Dr. Ryan.
Yeah.
So regarding the House Street landfill, we had a visit from DEP actually 3 weeks back. The inspection went well. Everything at the House Street landfill is good. Regarding the monitoring, or the numbers we have with all that stuff is good. But where we need to make some repairs. With the vents. There is some other stuff regarding repairs that's going on. DEP is going to be sending us a letter regarding the repairs. And I was actually working on, me and Laura was working on the budget. We have put some money for those anticipated repairs at the landfill that should be coming up, in the coming months. So that's from DEP. Housing cases, Chestnut Place apartment still, cases are still going on. There are 3-4 open cases. We did had a call from a resident yesterday, kind of looked distressed to me, had some water leaks in the unit, but didn't want me to come out, right away. So, there are definitely improvements from the last time they was in front of the board, but still going on, So I guess we was able to close one case. We're still, I guess 3 still open, and one more case we are looking that we're gonna come, that we'll be getting,
Yeah.
137 Pond Street. I did had an email from Attorney General's office a couple of days back, confirming that they will be reaching out to the residents or the occupants, in coming couple of weeks, about the process moving forward. The building commissioner had sent an email for the removal of the vehicles, the camper, and there was another vehicle found on the property, and those letters have come back undelivered. So, and the building commissioner is off right now. He did had his something medical leave he's on. So once he come back, we'll follow up on that. 21 Main Street, we did pick up a housing case on this one of their units that didn't have a functional refrigerator for a long time. According to the occupant, it's like 3 months. So we did follow up with the letter, and I had an email from the management stating they'll get fixed today. So hopefully I'll be able to confirm that tomorrow, that if that piece of equipment, refrigerator, was delivered to the occupant. Mill Pond, no complaints. We did get updated pest control reports, and I guess they have applied for the permit. I don't know if there are any different plans, for the operational side. I guess they'll be continuing to operate in Ashland as of now. The information we have.
Are they
Raj.
empty, Raj? Do they have a census? They still have people in there.
That is correct, sir. To my understanding, yes. And there was something that they had with the state, that I guess we mentioned it in the last meeting as well, that, they was trying to sell the place, and the state have some objections, or they didn't approve it, or something on that nature. I guess the board was copied on that email, that we got.
Okay.
Restaurant updates. We have 3 restaurants that are going through change of ownership. Las Cobos, Dairy Queen, and Bigfoot. The owner of Bigfoot was here. The new owner yesterday did apply for the permit. We have some standing violations from our Friday inspection, and still some more paperwork that we need to get. And once that, we'll be granting them permits, and still pending with Las Cobos and Dairy Queen. Regarding the flu COVID clinic, so we had 1 clinic today. We're doing good numbers, I guess this was our 13th clinic so far this season for flu and COVID. Barbara, I have attended actually a couple of them, helped out us on that, so thankful for that. All these clinics except one, that all was with Pine Hill Pharmacy that we did, and I guess we have given approximately 400 vaccines so far in this drive. And a childhood vaccine, I was collecting numbers for the budget. I guess we have done over 780 vaccines so far this year, starting from Jan 1st in the childhood vaccines. And we have one childhood vaccine scheduled tomorrow. And I am open for any questions now,
That's great on the vaccine front. How's the supply of vaccine? Is that something that's difficult to get? Are there shortages in any of them, or?
Dr. Ron, we are not doing COVID from our side, right? The pharmacy is doing it. Yes, there is definitely, it's kind of short supply right now, in the morning when we started the clinic, they had fewer doses of both Moderna and Pfizer available. In the middle of the clinic, the owner of the pharmacy bought in some more doses because we needed it. Yeah. It's just like, they are not getting that many doses. That's the demand kind of, So, yeah. So in the morning, they didn't have enough doses for our clinic, but they have to get to us in the middle of the clinic, Regarding the childhood vax clinic, that's except 1 or 2 vax, I guess we did do 9 kind of different vaccines in the childhood vaccine clinic. I guess state is pretty good, supplying us with all those vaccines. I guess so far with the flu from the state supplied, I guess we got 70 doses for flu from the state. And then we have 30 doses that we bought ourselves, the private doses. So we're doing good numbers on that.
Yeah, that's great. That's a heck of a lot of vaccines. And thanks, Barbara. I know you did that. That's awesome. Thank you for helping out. Yeah. Okay. Dave, anything? Jay? Barbara? No? Everybody's good?
Nope.
Okay.
Actually, I do have one, which is, are the total numbers of vaccinations available on the town webpage, or are those, can we get those numbers at some point?
Mr. Kingsman, yes, so Laura have asked me a couple of times, they have to manually count it, but now I got it for the budget purposes, that our budget was due today. So I have the numbers. We'll be updating on the website shortly, but for the childhood vaccine, right, it's approximately 770 vaccines from Jan 1st, and then with other vaccines, right, we're close to 400, maybe a little over 400 vaccines this year. That's again from, no, I'm sorry, the COVID flu vaccines, right, like that does include some RSVs, tetanus, shingles also, even the pharmacy got some pneumonia today. Those vaccines are from this season. So like, we started in September. So those 425, 430 vaccines are just for this season, not from the whole year, We did some clinic last time also, like in the beginning of the year. So that numbers I don't have, but this is from September that we have like approximately 425 vaccines, COVID flu. And the childhood vaccines, those numbers are from the beginning of the year.
Gotcha. Thank you.
Thank you. Thanks, Raj. Good
You're
work.
welcome, Dr.
Stuff.
Thanks.
Okay. All right, moving on to the consent agenda. Anybody like to make a motion to pass those as written? What'd I do? Oop, sorry. I don't know if I'm on. Anybody like to make a motion to pass the consent agenda as written?
Sure, I will, Ron.
Okay.
Make a motion to pass the consent agenda as written.
Okay, that's great. Any seconds?
I'll second that.
Okay, thanks, Barbara. All in favor? Aye. Aye. Okay, that passes 4-0. So that's great. So I guess we're on for January 2nd and the 16th. We'll get back to the usual 2 a month. So that's good. And I'm sure that, and I don't know if there's anything anybody, wants to bring up or discuss. But if you do, just tell Laura or Raj, and I'm sure it'll get on. We'll have all our usual things. So anyway, just before we leave, Jay, what's going on for Christmas with you?
We are staying here as usual.
Yeah.
Having a full house on Christmas Eve, which is usually something our in-laws would do, but they've since moved out of their house and into an apartment, so they can't do it. So new traditions.
Yeah.
Looking forward to it. What about you,
That's
Ron?
great.
Are you traveling? Philly?
No, I did that. We did that over Thanksgiving. So we're just sticking around, you have to share. So we had our kids on Thanksgiving. So both of them will kind of be with their significant others, although the older one, there might be a chance they're leaving later. So we might see them on Christmas Day for a little bit.
Yeah.
So it'll be fun either way. Yeah.
Good.
Dave, how about you? You're on mute. Mute.
Sorry about that. Pretty
okay.
quiet for us this year. No travel, and no guests. So, but we'll have some fun. We've only got let's see, we've only got 2 of these left before Nate goes off to college. Not like he won't be back for them in the future, but it changes that, I'm sure.
Yeah, that's great. We'll enjoy. How about you, Raj? Anything special?
Yes, sir. Thank you. I am actually traveling, just a couple of trips,
Yeah.
just on the East Coast. One of my childhood friend is visiting from India, so I have to bring him places, so I do have good amount of travel this time,
Yeah, that's great. Well, enjoy.
Thank you. I appreciate. Only other thing was Jan 2nd is right Tuesday, right after the New Year's, so
Yeah.
hopefully the board members are available, right? Or should we check back with you guys? Like are we all set to go for Jan 2nd?
I'm fine with that.
I'm fine with it.
Because school will be back, right?
Yeah.
So we don't have a choice but to be back in town.
Okay. But Dave, you good?
Yeah, I should be around.
Okay.
Yep.
All right. And so, all right. No, that's fine. So as long as we have 3, that's good. Barbara, if you can't, that's fine. No problem.
No, we should be. I should be around.
Okay. All right. Terrific. Thank you. How about you? What are you up to? Barbara.
We usually try not to travel Christmas. We have a tradition, me and the boys, just to we pick like a movie series. So we wake up, have breakfast, and just watch movies back to back.
I love it.
I know we've done Star Wars. We're still trying to figure out which one to watch this year.
Yeah. No Christmas movies?
Well, I watched those the day, so.
Okay.
They're tired of it already.
Yeah. Sandy and I watch, we typically watch at least Scrooge once and It's a Wonderful Life. So we haven't done that yet. So we will definitely be doing that. So that's great. Laura, how about you?
It'll be quiet. Yeah, just sticking around. Nothing.
Okay.
Plans on Christmas Eve.
Do you have to cook?
Christmas Eve. Yeah.
Christmas Eve?
Yeah. That'll be-
Okay.
Yeah.
All right. Well, that's
Thank you
awesome.
for- Thanks for asking, and I hope everybody has a wonderful holiday, including you.
Me too. Yeah.
Okay.
Mark, how about you?
How about me? I usually is my sister comes to the house and gets the presents, and probably
Yeah.
not to do that this year. And then we both go over to my brother's place for dinner.
Yeah.
And more exchange of presents, and then spend the day, afternoon, and part of the night. We stay within the town boundaries, so we won't get suspicious.
Okay. All right. Well,
And how about you, Ron?
enjoy. Yeah, we're just gonna stick around and hang out with the dog. And I got a stupid test I have to take, so I'll do that, for 3 or 4 hours one day, and just try to relax a little bit. So it'll be
So it's
it'll
gonna be a
fun.
dog day, Christmas afternoon.
Right. Yeah, exactly. So, all right. Well, everybody have a great holiday season. The rest of it's going to be over quick, and enjoy with your family and friends. That's what all this stuff is all about. And, personally, I'm thankful for the entire board, including, Raj and Laura, Dave, Barbara, Jay, the chief. You guys are all great to work with. This is the easiest thing to do. You guys really do all the work, and it's really nice to have a board that that works together and is functional, and hopefully the town can be proud of Jay. Especially with the undertaking that you and all the other people you had to recruit to help you out with this. What a beautiful thing for a lot of people. This is really what the Board of Health is all about. What you're doing is going above and beyond. That's beyond the mission statement of what it says. As far as the statement goes, which is just to keep the residents and visitors to Ashland, basically safe, and to go above and beyond like you are to have taken that initiative is really a beautiful thing. So thank you.
Thanks, Ron. And it's nice to have everybody on the board involved. Everybody here is involved, so that's makes it fun. So
right. Yeah. Well, taking the lead is just really a great thing.
Happy to do it.
Yeah.
And one last thing for me is the Board of Health. As the Board of Health, the town should say happy holidays to you all, for how to keep the medical things straight, and how to be informed, that the town can be informed by the town itself, the board, Raj, Lower, board of here. It's worth the time to be together, but the town needs healthy all together.
Well, thank you. Hey, and Raj, just one thing, not to discuss it. I got an email from Carl Hackinson about, he said an issue that we and the Concom share. Do you know anything about that?
Is there any particular, sir?
He just had emailed me, and I emailed him back, and I have his number. I just haven't called him. I think I'm going to give him a buzz. I just didn't know if you were aware that there's any mutual.
Is there regarding a septic system that on a property?
I don't know. He did. I haven't called him yet, so I just didn't know if you knew anything more than I did. But I'll call him and then I'll chat with you.
There is something regarding a septic system that we are dealing with on High Street. It might be that. But
Okay.
yes, please let me know. That I guess that's the only thing with Concom right now that we are involved. At like that way. But please feel free anytime. Just give me a call, please, or let me know.
Yeah, I think I'm gonna call him now and see what's going on, and then I'm surprised that he wouldn't just kind of go straight to you, but so anyway, I'll find out and I'll let you know. We'll let the board know. Okay.
Please, yes.
Right.
And happy holidays. Thank you so much.
Thank
everybody.
you.
Thank you.
Yeah, to everybody, Laura, everybody. Have safe holidays. Enjoy your family and make a lot of good memories. And we'll see you in a couple of weeks. All right.
Good.
All right. Anybody, like to make a motion to adjourn?
I can make a motion to adjourn.
All right, Dave, thank you very much.
I'll
Second?
I'll second it. Yep.
Okay, terrific. All right, all in favor? Aye. That's great. All right, everybody. We'll see you soon.
All right.
Have a good one. Thank you.
Bye, Laura.
Hey,
Bye,
thank you.
Mark.
Bye now.
Okay.
Bye.
Bye, Barbara. Bye-bye.
Thanks for